We're going to talk now to Dr. Semiya Aziz, NHS commentator and GP. Dr. Semiya, very good morning to you.
Good morning.
Nice,
good morning.
Nice to see you. I mean, there's a story out as well that says that the government's flagship NHS policy is kind of at odds with what people want. You know, people want to be able to access a GP. People want to be able to see the specialist when they get recommended to go and see one. But it doesn't. There's a sort of logjam going on. It's not really happening, is it?
What I would say, in all fairness to the government, there have been lots of changes in general practice. All you tend to hear about are the negatives, that you can't get an appointment. But in actual fact, there are lots of positives we've implemented into general practice. The underlying problem is recruitment of GPs. Now, what we have to understand, that we are short of GPs. GPs are leaving. GPs are retiring early because of exhaustion, burnout. You know, it's just too much for them. So we can't create extra appointments for patients if we don't have the GPs.
But the government keep telling us they're making they've told us they've made 5 million extra appointments. So, but the people that I speak to go, yeah, they make appointments and then they cancel them. You don't actually see anyone.
Well, I mean, in all fairness, I would say there are lots of systems available at the moment. It's not just that 8 a.m. scramble to get an appointment. We have lots of different methods of patients getting access to GPs. They can sort of do e-consultations, online apps now where you can apply, you can call in, it's triaged. But as I mentioned, we only have a limited amount of appointments. We don't have enough doctors to fulfill those appointments. And obviously it depends on demand. In certain inner city areas, the demand is far more. So we can't outsource them to any other places. You've got other we have to understand there are lots of multidisciplinary teams now that are helping offload some of the GP work. For example, we've got pharmacies, so patients can actually go and see pharmacists if they are under.
But those are not appointments. I guess what I'm asking you is, if Keir Starmer keeps saying that we've made 5 million more appointments, where are they? Appointments with who?
We can't generate appointments. This is what I'm trying to say.
He says he's generated 5 million appointments, though.
Yeah, but I can't vouch
for.
I can't vouch for what the government is saying, but certainly I can say from a perspective of the GP surgery, we are opening all our appointments. We are triaging them appropriately. We are seeing patients. Patients are being seen via telephone consultations, video consultations. So there aren't GPs sitting down having cups of tea. GPs are working to the max. And unfortunately, that's all we tend to hear. Patients are unable to get appointments. But I know certainly in my surgery, I've never sat down and had empty appointments. And unfortunately, the other thing we see is people do DNA. They don't attend their appointments. So there are many missed appointments. And so we have to factor.
What would you say in your practice? What's the kind of percentage of people who do that?
Well, it depends. We've got a very diverse population, so certain patients might not turn up because of language barriers. I would say possibly about 25% at times, at the best of times.
Why would people not turn up because of language? I mean, presumably they've made the appointment, right?
Well, there might be many reasons why they don't turn up, childcare reasons, but, they don't inform us beforehand. So we end up sitting there waiting. We're already running late in a surgery, and then we've got patients who don't turn up. So we have to contact them. We have to remind them they have to make another appointment. So these are wasted appointments, essentially, whereas they could have been seen. Sometimes they're double appointments. These patients are given double appointments. So once again, that other double appointment could have been offered to someone else, possibly.
Yeah, so sounds a bit chaotic, to be honest.
It is. I would never say general practice is not straightforward. It's not necessarily chaotic, but that's the way it's run, and that's the way it's been running for years. But as I say, there are lots of other places patients can go to. They can call 111 and then they will certainly get an appointment with a GP because it's sort of triage to the general practices. They can go and see a pharmacist for certain things. patients do not always need to come and see a GP for
No.
specific
I'm
things.
just still, I'm sorry to be banging on about it. I don't want to be a broken record. I don't know where these 5 million appointments are coming from, because it sounds like to me that they're being made at all. Sounds rubbish, doesn't it?
Yeah, I mean, I think we are maximising the amount of appointments. There are no more appointments. What we ideally need to do is recruit more doctors. We have opened new medical schools, but that's slowly in progress. We are trying to train up junior doctors. However, I would say we can't generate appointments if there are no appointments.
No, I get that. It's an interesting word, appointment, isn't it? Dr. Semiya Aziz, thank you very much indeed. Let's have a look at what Starmer says about the appointment situation.
We're happily going to go to our constituents. We're going to tell them we promised 2 million extra NHS appointments and we delivered 4 million extra appointments.
No, you didn't. You just didn't. There's no more appointments. You just heard it from a doctor. You can't generate appointments out of nowhere.